Welcome to the Never Been Promoted podcast and YouTube channel. I'm on a mission to help you cut the time to all the things that are holding you back so you can unleash your entrepreneur. I know you're wondering right now, does water really taste better from a Stanley? Fuck yeah, it does. You know, water doesn't suck out of a Stanley, but healthcare doesn't have to suck either. And we are joined today by Monica McKitterick. She is she's the founder of a crazy, Impact Family Wellness, and she's one of the best people I've seen perform on stage. Let me tell you, we were both on the block season 18. And man, she can rock a stage. I'm going to leave it there. We're going to talk about that. But she has rethought how you do healthcare and really making an impact in the community. If this is your first time here, listen, thank you for joining. We are on a mission to help entrepreneurs get better at entrepreneurship by cutting the tide, all kind of the crap holding you back. And we learn from the guests, their journeys, what they're doing in the world today, and some of the thought leadership they think to the future. Before we get going here, if you don't mind, jump on Never Been Promoted at YouTube. Give it a subscribe, youtube.com at Never Been Promoted. And if you listen to the podcast, give it a good rating. It helps the guests. I'm going to bring on Monica now to the stage. Monica, welcome to the stage.
Hey, Tom. How are you?
I'm doing well. It's good to see you again.
Good to see you too. It's been too long.
How long has it been? It was
August. So
it's October 2024. People listening to this, God knows when this will get produced. But,
right.
We were both on the block, season 18. Some of us did better than others. I'm just leave it at that.
Okay. We all went there to learn, Tom, and we all did. And we also went to make great connections, which is why I'm sitting here today with you.
That's right. Well, you know what the funny thing is? It's not funny thing. I went there the Sunday, and I got in I think Tuesday morning, or whatever it was. The Sunday before, I did not realize it was a competition until I'd watched all the videos, and then on Sunday I did a little more research for what I'd forgotten I had signed up for or done. I was like, oh my God, this is a competition. But I went into the blocks. The blocks, by the way, for those who don't know, it's a entrepreneurial reality show created by Wes Bergman. And I went in there, it's like, I'm going to go do one thing each day. I'm going to go learn how I can implement this in my business. That was my only goal. I was like, I'm going to meet 100 entrepreneurs. So that's definitely worth the time and travel and everything else. And that was my whole strategy. Competition, I was like, actually, that's fun. That's cool. That'll be entertaining. But you go there and you do it and you try to learn something and that is the way to go do that show. And that,
yeah.
How does it actually help you? So
it was pretty great. I learned new things every day. And my only regret is I didn't do it, 4 years ago.
Right. Well, it happens when it was supposed to, and now your exposure is going to be much higher because it's not one of the people aren't typically going back to season 1 to watch. They're going to watch 18.
True, they are.
It's going to be getting enough traction now. It might get picked up. You never know.
1 million views. 1 million views.
It'll be much higher though, because once you get to 1 million, there becomes a law of big numbers where it really, starts doubling up. So
yeah, absolutely.
Do you want to take a minute and talk about what who your company is and what it does, and then back up for your journey story a bit and just tell us a little bit about you?
Absolutely. So I am a family nurse practitioner, and I have been for 16 years now. And I'm just going to start from the backside, right? So I became a nurse practitioner to take care of people because that's always what I've loved to do. And so when I got into the career field, I realized that I was not taking care of people at all. I was doing paperwork all day long. 70% of what I did, paperwork. And as much as I tried to take really great care of my patients, I was restricted by CEOs and insurance companies and all these things. And so about 5 years ago, I'd been an NP for 10 years. I'd worked in multiple different places from family practice to internal medicine. I worked for an orthopedic surgeon for a while. I did venous and lymphatic medicine. Actually took people's varicose veins out of their legs. It was awesome. But I really had a passion for primary care because I know how to take care of a whole person, but it's exhausting. I saw 35 patients a day. I got about 3 minutes with each of them. And to be honest, what I love about healthcare is the relationships. Is I love like getting to know people and making sure they're living their best lives and how was your vacation and how are your kids and those sorts of things. That's what I loved about what I did, but I couldn't do it. I was just bogged down by insurance and paperwork all day long. So when I was getting ready to move to Texas, I was trying to figure out what I wanted to do with my life. I really wanted to do primary care, but I was 35. I had another 20, 25 years in this world that I just couldn't do it. So Facebook listened to me and sent me a Facebook ad. And the Facebook ad said, primary care physician takes home $400,000 a year and is home in time for dinner. And I was like, well, that's a lie. Great hook, by the way. Worked. Absolutely. And so I clicked on it. It was all about this model of healthcare called direct primary care. And I was like, what is this? So I dove into it and learned more about it. And then I went to my husband who has an MBA. And I was like, hey, husband, I am going to open my own practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. And he laughed in my face, Tom. Literally laughed at me. And he was like, Monica, that's not real life. You can't do that. And so I dove in a little further, Googled how to write a business plan. This was before ChatGPT would actually write it for me. I actually had to write it. So I wrote a business plan, took it to my husband, said, listen, I need 20 grand and I'm not going to get paid for at least 6 months, but I'm going to do this. And so that was the birth of my business. And so my plan was to give myself a job in my little corner of the world. So for those that don't know what direct primary care is, it is membership-based healthcare. So it's much like a gym membership for your primary care. So all of the patients in my office are members. They pay a monthly fee, $75 to $95 a month, depending on your age, and they get unlimited care. They can come in as many times as they want. There's no copays, there's no fees. We do all of our telehealth, and they can text us directly. We do 70% of what we do via text message. There's a time and a place where you need to touch a patient, but it is way overdone. If you've been on your blood pressure medication for 6 years, I don't need to touch you to refill it. That's dumb. It's a waste of time. So it actually puts the patient first instead of the insurance.
So when you do it that way, right? When one of the things that drives me nuts about the healthcare system is to, let's say, oh, I need you to come in every 3 months so we can take your blood pressure. And I'm like, why? And it's because there's an office visit fee that they go bill your insurance, and that becomes a revenue source for them.
It's the only way they get paid to do their job. Right?
I mean, it's actually one of the cleanest money they get because it's a service fee for you just showing up, and something they had to do or would do.
Yes.
Anyway, so and there's what you're describing is it's a frustrating system because there's so much overhead because there's an insurance company in the middle.
So much.
It's funny. So we'll get into that a little bit here in a minute, but and I don't have the answer because the further you are from a problem, the easier it seems to be to solve it. Right. Yeah. And the closer you get to, you're like, okay, that would be difficult. But the truth is you move an insurance company. Anyway.
Yeah.
And you're just said basically just pay this fee. We have these services. This is the range of things we can do. Mm-hmm. If you need cancer treatment, you don't come to us.
Right. We'll help you navigate the system, right? I'll get you to the oncologist.
Right. Keep you going because we'll get me all fired up and I'll be.
Oh yeah.
I'll start drinking again. It'll be your fault.
I'm planning to throw stuff here, Tom, because this is the passion.
I didn't expect any less. You didn't get on here just to kind of tickle. No. We want punches, bro.
Absolutely.
All right. So keep going.
Yeah. So I opened my practice 5.5 years ago and it quickly grew. I moved to Texas, moved to a new state. I was in New Mexico prior. And so I didn't have a following of patients to come with me. And so I opened my doors on April 1st of 2019, and I had convinced 23 people that I knew what I was doing. before I opened my doors. And then I just continued marketing and continued networking and telling the world that I knew what I was doing. And now I have 3 locations. I have 7 nurse practitioners that work for me, and we have 1,800 patients and counting every day. We have a service that people want and they need. They just don't know it exists. It's this new thing where it's like, oh, wait, you don't take my health insurance, I'm not going to talk to you. It's like, wait, no. I'm going to save you money. Even if you have health insurance, you can still come to me and I will still save you money. And it's just by getting rid of that middleman, right? Just like if you buy a diamond ring, if you go directly to the guy who gives you the service, it's cheaper, right? And so we cut out all of that in between. I mean, even when it comes to lab work, right? Like I can do a testosterone test for $6, where if you do that through any insurance company, it's going to cost you.
Any lab test, it's $99.
Yeah. Mm-hmm.
That's insane. And actually, I'm like, oh, that's not that much. But I'm thinking, but $6 sounds better.
Yeah, it sounds way better. Yeah. Like
what you're doing is basically you're getting a common fee, and you can operate your business for the things they need to do. They don't pay additional for those things because you're just going to do what's absolutely needed versus what you can make additional money on.
Absolutely.
Does that set you up though as a, if so, I guess it could create they won't run that test because it costs them money, right? So how do you navigate that?
Sure. Well, we run tests that are beneficial to the patient, right? There's so many times in healthcare that we run the test just because that's what they say we should do. But if that's not going to change the outcome, then why are we running the test?
Well, don't they run it usually so they can properly build the next step for the ICD-10 code? Is if you don't run these 15 tests, the insurance company is going to kick off the next thing we need to go do. So we have to go do all these things first. So they have that data.
Right. Especially if you have an injury, right? You can't get an MRI without doing the X-ray. It's like, but this is clearly a soft tissue injury. Like there's no fracture. That's not going to show me anything. But then you have to jump through the hoops, and then you have to do 6 weeks of physical therapy before you can get the MRI. It's like, but what if we knew what was wrong before we did the physical therapy?
Yeah. Well, I don't get that at all. Cause like physical therapy on something, I'm not even sure where the tear is for sure. Like,
right. Turns out no amount of physical therapy is going to fix a torn ACL. Right.
You can get strong all around it. It's still going to collapse.
Do you need your ACL is the bigger question, right? And if you're a 40-year-old mom like me who doesn't play sports, or like I walk, I like play pickleball in general, but I don't necessarily need an ACL because everything I do is moving forward. I'm not like a competitive skier.
You're not rotating.
Right. And so do I need an ACL? That's the bigger question that we should ask before any of this. Because
every time I get on and off a ladder, I'm glad my entire knee is intact. Because I mean, I'm going to go out like Gary Coleman. It's not going to be a full ladder. It's going to be like a step-up stool. I'm going to fall and like, done.
Yeah.
All right. So you have this business that is a membership-based. You go there to get just your wellness prevention. Is it more on the, oh, I hurt, or on the prevention side?
So we do both, but here's the thing, Tom.
Preventative, I guess, is
our healthcare system is not healthcare. It is sick care, 100% sick care. They don't try to prevent things from happening. They wait until you're dying and then we fix it, right? So for example, diabetes. Diabetes is rampant across this country. We can all admit that, right? The number one best test to see if you have diabetes is an insulin test. Now, tell me the last time any healthcare provider in the insurance-based world ordered an insulin test for you. They don't, because insurance companies don't approve it. I do it on my patients all the time because it costs us $5.
Wait, don't they do just a blood sugar and a fast?
Yes, so they do a fasting blood sugar, which by the way is going to be the last thing to change. That's going to be the last marker, right? If your insulin level is 22, you're going to be diabetic in the next 6 months. I can tell you that, unless we do something. And so why would we not check the first indicator instead of the last? And the answer is it's expensive through insurance companies, right? If you want to get an insulin level checked, it's going to cost you $180. My office, it's $5. I'm like, hey, dear patient, please, let's check your insulin level, because that is a much better determination of where your blood sugars lie, of how much insulin your body is producing. But that's not how our healthcare system works.
So what state do you live in?
Texas.
You're in Texas. So, and your professional accreditation goes to what level?
So I'm a board certified family nurse practitioner. And so we can prescribe medications, we can see patients, we can diagnose, we can do all the things. In the state of Texas, we have to have a supervising physician. So we do, it's a contract. He doesn't actually see patients. He's a surgeon. But
that's how I think in Georgia as well, that Actually, I don't know, because there's certain states have different rules of how far a nursing practitioner can go.
Yes.
Some states can have it, but they can't even do any prescriptions outside of like Advil, OTC stuff, right?
Yeah.
Over the counter
So
stuff.
as nurse practitioners, I believe in every state we have the ability to prescribe at least up to Schedule 3s, which includes like benzodiazepines like Ativan, Xanax. In the state of Texas, we aren't as allowed to prescribe Schedule 2s, which are like narcotics and ADHD meds. So our
And
supervisor.
testosterone.
So testosterone is level 3. So we can.
Oh,
We
good.
do prescribe testosterone also.
Anyway, by the way, guys, if you go to men's clinics and you're paying like $400 or $500 a month, that stuff costs like $33 cash pay. I'm not sure why you're paying that much, but anyway, we'll keep that.
Yeah, we do those injections in our office for $8.
What do you, I will tell you, learning how to self-inject.
That's rough. I don't think
I can do it. I can do it now without any pain or blood.
Oh, nice work, Tom.
I have you pinch part of your thigh. You got to get your spot. And when you inject that, you better go slow, because if you go fast, it will find a nerve. And I promise you're going to pull that thing out as reaction. And then you're right back to shit. I got to stick this thing back in.
Yeah. Yeah. No.
Anyway, sorry.
Good job. Tom. I like it.
I had to self-learn.
You can basically do anything physicians can in the state of Texas.
I may lose my camera here in a minute. If those listening and watching, my camera is red and it's angry. Usually it's green. I know this has nothing to do with what we're talking about, but I think it's funny when technology got upset there. I think the healthcare system and the people who be have hacked my system like they're talking bad about it. Kick them off.
Yeah, it's the CEO of Blue Cross Blue Shield, because he made $250 million last year.
Is that it? I mean, you know what? To be fair, the guy who started OnlyFans did take a $500 million bonus or a dividend, but I think he earned it. So,
yeah, I'm gonna tell you, the guy who runs Blue Cross Blue Shield, he's really good at telling people to hit the deny button, but other than that,
right. Yeah. Let's dive into that. So, so you've built this company, this journey along the way with, because you had, okay, so anybody could have done that. Let's say like anybody, but you did it because you had a real goal of actually trying to help people, and you couldn't do it in the system. It was not allowed. It was blocked by business reasons, by people, by insurance. And you're like, screw that. There's a model that works. Like if I charge a few $100 a month for an individual, the math says basically for the most 95% of the stuff you can do, and you know the stuff you shouldn't be touching because it's either illegal or really too expensive, and it needs direct physician care. But so you built this model. What do you do though when someone comes in, you're like, okay, this one basically, if we treat this, is going to, eat up 5,000 membership numbers, like, because some people are less expensive than others. What do you do when you run into somebody who really needs a different level of care that maybe you didn't think of, or you're kind of like, oh gosh, we need to make sure this is not on our list of things we can actually treat because it's just too expensive for us to do? How do you handle the business record part of it?
Right. So for the most part, our biggest cost is our providers and their time, right? And so we only offer services in our office that A, we are good at, and B, we can afford to do, right? We've been approached by multiple like big companies like, hey, buy this piece of equipment and you can do Morpheus 8 treatments. It's like, yeah, no, we're going to stay in our lane, right? We are not functional medicine. We are not aesthetics. Do we offer Botox? Yes. It's because I wanted Botox and I need some right now, in case you're wondering.
I need some. And this is with touch up. I mean, I look like you could wash something on my forehead.
Yeah, we can help you, Tom. It's preventative, by the way.
Is it preventative?
Well, yes. So it prevents those like
I got you.
guys, from happening.
There's a new classification of preventative. It prevents you looking wrinkled.
Absolutely.
Oh, I'm sorry. Keep going. So you stayed clear of but look at how much more revenue you can have. Yes, if I was doing an insurance company, but I'm not.
We absolutely know how to stay in our lane, and I'm not willing to go outside of it. Every time we offer a new service, a new something, it's more administrative work, right? And one of the beauties and the reason that direct primary care is affordable is because we keep our overhead low. I don't have medical assistants. I don't have nurses. I have 7 nurse practitioners and 2 administrative staff. That's it. And we manage all of these patients and we manage them incredibly well. And so every time we add it, it's just like if you add a new SKU to something, right? It's more things that have to be dealt with. And so we like to stay in our lane. Now, there are times where patients will be like, hey, so I was getting this service over here. Can you do that? A great example of this is IV therapy. It's all the rave now, right? Like everybody wants their vitamin treatments and all the things. Could we do that in our office? Absolutely. But you know what that takes? Time and space, because those infusions can take hours to do. Well, I don't have a nurse that can sit there and monitor you.
Mhm.
And the cost of those, like the raw cost, is expensive. And so if we buy one and then it expires, we're screwed,
Yeah.
right? And so it's all about the benefit to our patients. Is it going to be enough of a benefit and move the needle enough for us that it's worth
Yeah.
the cost, right? It
Well,
was when
You,
COVID
you well,
vaccines.
listen, I love that. And we were talking about testosterone like before, right? So
Mhm.
I looked at that, right? I'm like looking at, okay, why do I feel so low and slow? And I think I don't think a lot of men realize you're slowly where estrogen might hit women harder, faster when they, and like, they're, oh my gosh, I feel this. You're a slowly boiled frog.
It's true.
And what happens is you start getting a little more tired, a little fatter, a little less muscular, and a little more or less sex drive. That's because your testosterone's tanking, and you don't have to feel that way. So you look at men's clinics, super expensive because they make you feel comfortable. You look at it, you next choice is urologist. Don't have to go there either, honestly.
Yeah.
The truth is, you need someone to test testosterone, your what do you call it? Probably thyroid and your estrogen and your red
Mhm.
blood count, so you can see if you're gonna go choke. That can be done, I bet, at your clinic pretty inexpensively.
Oh yeah.
And then you can subscribe the testosterone to get the numbers to wherever they're legally allowed. Funny
Mhm.
enough, by the way, men's clinics will push you up to 1,200, whatever the number is. And urologists like, well, we want to stay around 700 because we want to be risk adverse to the insurance company. I'm like, well, I'm paying cash. Push me up as far as it's legally allowed. Please.
Yeah,
Anyway,
and
the
where
point being
is
is, what do you do there? Like, you have whole markets that people don't realize do not have to cost you $8,000 a year to get
yeah,
treated. It could cost you $33 in medicine every 90 days.
yeah, absolutely. Yeah, I mean, that's really what it boils down to is what's best for the patient. And here's the deal. I don't care what your numbers are. Ultimately, it matters how you feel,
Right.
right? If your level is 700 and you feel like $1,000,000, then awesome. I'm here for that. But if you're at 700 and you still feel crappy, then yeah, we do need to push you up. And by the way, if you try to run your testosterone through your insurance, they will not improve it unless it's below 200. 200. Like,
Wow.
I'm sorry, but no 40-year-old man, even a guy in his 50s or 60s, shouldn't be at 200. But not
Well, I
only,
will tell you, like, I was told less than 3,
yeah,
and I was, like, hovering just above. I'm like, "Yeah, but I feel like a
right.
turd."
Yeah, but no
And
insurance
so,
company
anyway,
cares about
I
that.
had to get, like, 240 before they're like, would look at it, and I'm like, "I'm just gonna go to another provider if you won't take care of this."
Yeah. Well,
Can
and
you come
someone
across
said
state lines, or do you have to stay everybody in Texas? Has to be
all
a
of our
resident.
patients have to have a residency in Texas.
Isn't that
Um,
weird? 'Cause I'm pretty
yeah,
sure your skills transfer state to state.
they should. And when COVID happened, they did, right?
Oh,
So when
that's okay
COVID
now? Oh, I
happened,
see.
they let us cross state lines, but then they took that back when COVID
See,
went up.
that's protecting income and not best practitioners.
Well, and part of it is it protects the states, right? Because every state that I'm licensed in, I have to pay money for. So if I want to see patients in New Mexico, then I need a New Mexico
But
license.
do you have to be physically located there, or can you do telemedicine?
You can do telemedicine. So
Oh, so you just gotta okay, but some
I
states
could
I
get a
assume
license in 12
they
states.
will let they won't license you unless you live there too. So,
Right. But you also have to be careful with your DEA license. So your DEA license has to be tied. So that's the license you have to write controlled
right,
substances
yeah.
like testosterone, right? That has to be tied to a physical location within the state where you are prescribing it. And those DEA licenses are only, $888 every 3 years. And it would be state specific. And you'd have to jump through a lot of
I mean,
hoops.
there's so much business in Texas. I mean, outside of just they're opening it up because you need to help more people.
Yeah.
You guys are single location currently looking to expand, is that right?
So we have 3 locations
3.
currently.
Okay, you have 3 locations.
Yeah. And, I don't know if I necessarily want to open another, to be honest. Like, it's a lot of work to do that. And
Yeah.
I did not go into business to lose control of my time. Went into business to gain control of my time. So my plan is,
Are you still in the weeds meeting people?
so I still do a lot of the marketing and sales and networking side of it, but I don't see patients anymore.
Okay.
I gave up my patients in February of this year so that I could just run this thing. But if I fill all my clinics, right, that'll be around 4,000 patients we'll be helping. But ultimately at this point, Tom, like, I want to help other healthcare providers do this too, right? it's not that hard to run this clinic, right? I just need to find the right people that want to do it. And so I really hope that my path moving forward is more educating not only the general population, but also other nurse practitioners, other physicians, other physician assistants who want to take care of patients the way that we do, but can't, and are burnt out and are just losing their mind, because they can do this. This isn't hard. It takes some effort. But ultimately it's such a better way of life. And
Is
so
there a franchise model you could do where someone like myself could own the business and then I'm hiring a nurse practitioner and then you have a list of friendly doctors that come in and say, hey, yeah, we know that brand, we'll sign off on that?
there definitely is. We could definitely franchise it. Once again, I don't know that I want to do that work necessarily as much as I would just rather be a consultant. Like, let me
Right.
teach you how to do it. Because it's not my name and my brand behind it. So, I'm not exactly sure on what that looks like. I want to write a book. I want to do more talks. Like I'm doing a lot of speaking at different conferences and, maybe a TED talk.
Yeah.
Maybe next.
I like that. I do know a really good ghostwriter. So if you want one,
Ooh. Yeah, because I don't actually want to write a book. I just want to
you want to talk.
stories and let somebody else write the book. So
I tried writing. It's tough. And you're a speaker, you're a presenter, not too amongst myself. We talk better than we write because we start writing. We're like, I don't know what to do next. It's blank page.
No, I'm here for that.
And GPT doesn't even do a good job of the brain dump. Even it's like too much. Can't handle you.
Right.
Tell me about the future though, a little bit. So, why haven't more, why isn't this not the way to do it? It seems like it's a more profitable business. It seems it helps. The person who's screwed here is the insurance company. You do work alongside them. Don't get me wrong. So like you guys, you do take them, but that's where a patient basically, maybe you describe it. When do you use insurance and why?
Sure. So in my ideal world, all of my patients have some form of catastrophic coverage, right? A high deductible plan, a health share, an AFLAC plan, a something, because I can handle 80-ish% of your healthcare needs, but God forbid you get cancer, God forbid you need your appendix removed. I'm not your girl for that, right? So that's where insurance comes into play. Health insurance was meant to be like your car insurance. Your car insurance doesn't pay for your oil changes and your tires, right? It only is there when shit hits the fan. Ooh, am I allowed to say that? It's only there when crap hits the fan, right? And so that's what health insurance was really meant to be for, but that's not how we use it now. So in my ideal world, all of my patients have my membership so that I can keep them happy and healthy and out of the hospital. But when the crappy things in life happen, then we can use that insurance. And so we do work hand in hand with them. That's really the best place to go. We also work with people who have really great insurance plans, but are just done with the crappy system where nobody will call them back or answer their questions or, spend more than 2 minutes with them. So we work really well with insurances. We just aren't going to let your insurance company dictate how I take care of you, right? So I don't know if you've ever gone to your annual physical and they say, oh, is there anything else you want to talk about? And you're like, oh yeah, actually, I think I might have a sinus infection. Like, oh wait, you can't talk about that because now that's not
right.
It's now.
Well, no, they do. And then you get a separate bill. And then my wife goes, why did you say that? I'm like, because I'm at a doctor's office. I'm not sure what the rules are. She's like, you should learn this. I'm like, I shouldn't have to learn this. I should be like, I feel like shit for these. Here's this bump. It's a fatty, whatever they're called them. He's like, I'm not sure it's not cancer. I'm 100% sure of it. I'm like, are you? Because you did no tests. I don't know. So anyway.
Yeah. So we can do your annual physical, talk about your blood pressure, cut that mole off, and do a joint injection all in the same appointment, because that's what should be done. That's how you take care of people, right?
Right.
And so, we can work alongside with them. But when you look at, right, your question of why doesn't everybody do this, right? And the answer is there's a barrier to entry, right? So people who have degrees as nurse practitioners, PAs, physicians, they tend to have a lot of student loans, right? Like in the 6th year, student loan.
I'm sorry, that's funny. My personal situation is going to impact healthcare because I can't afford.
Right. Well,
I'm laughing because that's like the number one barrier to becoming an entrepreneur is a financial commitment, like a student loan or a mortgage. So
yes,
I'll be quiet.
So most of these people are used to making 6 figures, right? Like that's the average
deep
salary,
6 figures. Yes.
Right. And especially for like a physician, like they make 250, 300, even as a primary care provider, if they're in a big hospital system, but they're also working for the man and it's not great. So when you open a DPC, you start at 0, right? And you have to build that. And we as healthcare providers are not trained to be business people. We don't know how to do marketing and accounting and taxes and all the things. And so you have to be the type of provider who's like, you know what, forget it. I'm going to go do what's best for me. And then it grows, right? I will tell you, I was cash positive month 2, right? Now that was not paying myself, but I was able to pay all of my overhead 2 months into my business, right?
That's amazing.
And so if you do it right, then you're fine. But also it takes work, right? So if you're just an insurance-based provider, you don't have to advertise because your insurance company does it for you because you're on their list of preferred providers. No one walks in my front door because their insurance company told them to. They walk in my front door because their buddy told them about it, or they saw us on Facebook, or they saw us on whatever. And so it takes time and effort to do these things. Now, it's a significantly better situation for the provider and the patient.
But can someone walk into your office and be like, I feel my family feels sick. You're like, great, here, fill these forms. Here's your membership, pay your membership in cash or however you want to. Do they have like an initial fee for the initial screening or?
No, so we don't have an enrollment fee. What we do is bill first and last month up front. So we spend a lot of time. All of our new patient appointments are 60 minutes, right? And then there's a lot of follow-up that happens with that. And so I personally hate enrollment fees. I think they're the dumbest thing ever. They piss me off. And so I was like, I'm not willing to do that. And so we just bill first and last month. We do require a 30-day notice to cancel, but that's the only contract that there is. And so they're just paying that last month up front, right? And so no, there's no like big to do. You can register online. It's super simple. You fill out all your paperwork online. I hate paper. We don't have paper. We don't do paper. You schedule.
I think I talked about this, like, when you first started business, I didn't have formal insurance. We used Medicaid. And it was the best coverage I've ever had because it was covered. So you actually got, the nuclear test done, stress, like all the stuff that I know they're billing the shit on the insurance for. They're like, oh, slightly off EKG. Woohoo, $10,000, $20,000 Medicaid patient. Let's get them all the shit he needs. But the truth is it was preventative. I learned something about my body and what was going on.
Yeah.
And to me, I was like, why isn't it like this? Because I'll actually, now that I'm paying insurance again, I'm like, I'm not spending $6,000 to go find out. It's set up to fail. It's set up so you don't spend money.
Absolutely. Well, and so many people don't understand their insurance plans either.
Who can? It's not exactly, it's like, children's reading.
Right. It's like, do you have a high deductible plan or a copay plan? Do you have an HMO or a PPO? And most people do not know the answer to that.
FSA. Who knows what the difference between those two things are? Unexplainable. No one knows.
Right. So I'm not sure who marketed health insurance, but they're geniuses. And I need to know who it is because they have a very expensive product that no one understands, but everyone buys it. And my mind is blown.
Let's dive into that future a bit because from afar, the problem seems simple. To me, catastrophic insurance shouldn't even be private. It should just be provided. We have a very rich company. I'm not trying to say we have a socialistic thing, but the truth is catastrophic stuff can be classified. Heart attacks, cancers, whatever. Okay.
Absolutely.
Everything else outside of it, unless you truly have no money, I feel like could be covered for way less in the model you're describing. Like that's like 90% of it. Let's say, I don't know, maybe if the number's wrong, but it seems like 90% of what happens. Let's check out. Let's look at the moles. It's okay. Listen, hey, that one you might want to go see a specialist who's required, or we can remove it because it's not that freaking hard. Whatever. The point being is, it seems like the future is remove the need for. Do you buy insurance because you're worried about some catastrophic thing that probably won't happen to you?
Right.
That's why you buy insurance, because the truth is it's just cheaper to pay cash. I mean, 100%. I don't know how, if you make less than $100K as a family, you can afford insurance when it costs you almost $20,000 a year if you use it. Yeah. It's unbelievable. No matter how the plans work out, by the way, they always work out between $18,000 and $22,000 if you use them at all.
Yes. Agreed.
And I don't know about you, but that's a pretty large tax that's going to a private company that seems to deny a lot of shit.
Oh, everything. Right. And because they can. Right? Like I send in an order for a patient and they're like, nope, not doing that. And I'm like, wait, I'm the one who went to that school for 9 years to determine what was best for my patient. And now you're some guy sitting behind a screen over at Blue Cross Blue Shield who says no. I wrote a prescription for a diabetes medication for my patient and it was denied by a pediatric ophthalmologist. That's a kid's eye doctor. What is a kid's eye doctor doing reviewing my adult diabetic patient's prescription?
Correct. Not even a diabetic expert.
Right. Well, then there's the whole like drug issue, right? So only in the United States do we pay for research and development, which is why our medications are so expensive. So we actually order a lot of our medications for our patients from Canada because they are significantly cheaper. My father-in-law is on a medication because he has a heart problem. And if he doesn't take this medicine, he will die. Like it is a life and death thing. Of course, he's on Medicare, and Medicare doesn't approve the medicine. That is $672 a month here in this country.
And it's like $8 probably in Canada or something.
So I order the exact same medicine. I get him a 3-month supply for $110.
I heard this. This happened something else too that was interesting. My neighbor's like, "Oh, I was using peptides in my shoulders." Now, I'm not exactly sure. I think you just basically inject some type of thing, blood, whatever, DNA. It repairs your shoulders.
Yeah.
Allowed, and all of a sudden, FDA said no,
Yeah.
no longer allowed.
Sure.
Legal everywhere else, but here, and it makes you question the motivation of why, because it works.
Yeah.
During COVID, there was this bacteria thing it was like basically for, I don't know what it was, but you could get it in Europe. That people were taking it in Europe as a way to prevent parts of COVID. When you got COVID, you took like day 2 or 3 and your recovery came back. We may or may not have gotten some, and it did work. But it was illegal to have it here because you had to go do the Pfizer route or you had to go do the other route. And it really questions the integrity of any of this stuff when it's so tightly coupled of what you can see happen with FDA. And it really, like, the integrity of the system, I feel, is incredibly broken. And I think no one else really trusts it. Yet you're required to have all these insurance requirements that just fund money to companies that aren't even they're really not even regulated. It's crazy what they get away with.
Well, and so many of these large health systems restrict their providers from doing things that are not FDA approved. And there's a time and a place where FDA approval is very important, right? But there's also clinical experience, right? I've been doing this for 15 years. I have a clue what I'm doing, and I base my clinical judgment off of what I've seen. Yes, do I take into account the FDA and their rules and regulations and what's approved and what's not? Sure. But the FDA also is not seeing patients all day long, right? And I mean, the other side of this is the food we eat in this country is a little questionable, right? Like something like 80% of the foods that we eat here in the United States are banned in Europe. I just went to Europe. My kid ordered Fruit Loops, and they were like, "Yeah, we don't actually have Fruit Loops. We can give you our equivalent." And it was this bowl of like little circular things that were totally white and pretty much flavorless, but that's because high fructose corn syrup is not okay. Like they've banned it.
And I think we're the only country that uses certain types of pesticides.
Yeah, but it's because, we have these lobbyists and,
so we definitely, when we travel to Europe, like the bread, like, things taste different. And I'm not saying Europe's got it all figured out, but
sure, no,
there are challenges.
Yeah. Well, and I also I don't think a socialized healthcare plan is what will fix this country. I do think having catastrophic coverage for everyone is necessary.
Yes.
But the bigger thing we need to do is focus on prevention, right? And how do we prevent people from having 42,000 heart attacks? And that's by education and follow-up and lab work before they get sick.
Correct. Just like at 30, go do, I don't know, the thingy, the MRI, the little ultrasound on your heart, see if there's any leaking.
There's so many barriers to healthcare in this country. Not only cost, but time, relationships. Like there's nothing scarier than to walk into an office as an overweight person and you are immediately judged and thought that you're a terrible human, right?
I do this with fat kids. I see little kids that are way overweight. I'm like, I hate the parents for this. I mean, it's all their fault. Am I being too funny right now? I don't know. It's true though. I'm actually more judgy when I see a little chunky kid with an attitude. Like, listen, dude, stop. When you're 100 pounds overweight and you're 7, okay?
Yeah. Well, that little chunky kid also is not choosing what is purchased at the grocery store.
I know. That's why I look at the parents and they're shoving ice cream in his face. I'm like, I understand Johnny should be rewarded. Maybe he's dropped 40 already, but he's got 100 to go, okay?
Yeah, but that's probably how they were raised too, right?
Then you look at the parents typically and you're like, not working out for sure. Is that judgy? I don't care, honestly.
Don't make your kids judgy. But ultimately, we need to focus more on healthcare in this country, right? Like we completely don't deal with sleep. Sorry, my light just died, so now I'm going to be dark.
You know what though? I forget the term is, but now you look very serious. Like it's like half light, on your face.
Right.
You're like,
I have a
our
light.
story begins
I only have light over
in the
there.
deep,
And
dark
yeah,
closet.
this one doesn't.
Um,
So,
well, just conscious of time too. Listen, first of all, if people want to get a hold of you, it's Impact Family Wellness.
yeah. So,
Anybody in Texas, by the way, you don't have to be in your city. You can leverage. If you're doing a once a year physical, what city? Where's your city again?
so we're on the north side of Austin is where our 3 locations are.
Austin. Guys, that is in Texas. Those who are not in Austin, there is a city called Austin that everyone in Austin thinks is their own city and
Yeah.
not part of Texas. I
Yes.
don't get it, but
We
it
are a
seems
little
like there's a politically charged thing there.
Yeah.
That's a good question. Would your model work in a less liberal city?
Absolutely.
Okay.
And it has. So here to tell you, yes, my clinic is the best DPC in the nation, but there are about 3,000 other ones. So there is if you Google DPC, direct primary care mapper, it will pull up a map of all of the offices like mine across the country. They're everywhere and they're popping up more and more and more. This concept has been around for about 15 years. So yes, mine's the best, of course. I believe that. But there are other people doing great things as well. So
That's fantastic. We'll leave with this note. Block season 18. You got to check it out.
yeah,
Like I said,
we'll be
some people
there.
did better than others.
Tom, you were the first person I met there.
Yep, we met in the air. We both got off. I think we were on the same flight even from Atlanta over.
Oh no, I came from Tulsa.
Oh, then we just ended up just being in there at the same time. All right.
Yeah, you were probably on the same flight with Evan.
I was. Yeah.
Yeah.
I was on with some superstars. Let me just tell you, I was like surrounded by greatness. And you guys know how the blocks work. I made sure I sat behind one or two of them every night so I could get airtime.
Oh, I love it. Tom, where are you?
I'm in your basement.
Oh,
Atlanta.
so I'm
You're
coming.
When are you coming along?
November 12th. Well, 10th, 12th. We'll have to.
I think you have all my contact information, and I'll make sure I.
Oh, I got your number.
Oh yeah, you do. And what brings you to Atlanta when you come here?
We're actually coming for the Duke game. So Duke plays in the State Farm Championship. I am a Duke alum, and so we are coming to watch the Duke game on November 12th.
We'll make sure we get time
Yeah.
together. Thank you, Monica, for coming on. You rock. It's always great to see you again. I'm going to put you in the periwinkle room. I'll be right back. But thank you. Listen, get a hold of her at impactfamilywellness.com. Thank you, Monica.
Thank you, Tom.
Everyone who made it this point in the show, thank you. Monica's brilliant. You've got if you need maybe you're a podcast host, you want to talk to somebody who's really thought through a business, does it well, executes it, fantastic speaker. You got to get in touch with her at Impact Family Wellness on LinkedIn or however the many ways that you can get a hold of her. Just a great human, and honestly, was the first person I met in the blocks, and it's crazy. Just we were in pods together, and you'll see the show coming out season 18. It's gonna be fun. Thank you for listening and being part of the show today, everyone. If you get a minute, go to youtube.com, subscribe. It never promoted, but I really appreciate everyone listening. Till we meet again, get out there, go unleash your entrepreneur.